I'm Dr. Rajani, and if you're over 45, 50, you need to stop this one habit that everyone's doing and adopt the 3 that I'm going to tell you today. 2 of these are pretty much free, and 1, for most people, they're going to get this in clinic. Now look at this picture here. Pay attention to the glabella, or that frown area in between the eyes. What do you see in this particular picture here that you don't see in this picture here in that same region? Think about the 3 most common areas that people get treatments like Botox in: the forehead, the frown, and the area around the eyes. What do they have in common? Well, none of them have a lot of fat in those areas. And it's articles like this one from Vogue: why preventive Botox might be aging you. The very thing that some people are using to keep them younger might be making them look older. And as a side note, of course, I make a good part of my living off of injecting Botox. Am I worried about this? No, because of the 3 things I'm going to tell you that my patients already do. And to make matters worse, what are our youth doing? Well, look at this article on Gen Zs. Why smooth-skinned Gen Z and millennials are getting anti-wrinkle injections. They're doing it. And can we blame social media, marketing, and big pharma? Well, most likely, yes. Getting Botox injections is much like polishing or waxing a rusty car. While the surface might look okay, the structure and support below is deteriorating and will eventually cause problems, like today's video I'm saying, by 45, 50 plus.
You see, collagen and elastin is the support and structure of your face. Botox does not build collagen and elastin, and we all know volume in the face creates youth, and as we shrink the muscles down by using Botox, because that's what Botox does, we're actually losing youthful volume.
Now let's go back to those pictures. If you look at the picture here, the initial one, look at the glabella. There's some fat loss. And you can see sometimes the brows widen and they drop medially as well, because you're losing the support and structure of your procerus muscle and your corrugators that go along laterally. Now, if you compare it to this picture here, you can easily see there's a little more volume there. And sometimes, yeah, there will be frown marks. I'm going to tell you how to get rid of those in a moment. And today's video is not just about just the glabella, just the forehead, and just the eyes. It makes a bigger point that you're going to get for your complete face, and my solutions are for your complete face, because we don't just spot treat that car, we treat the whole thing. We treat your whole face. And if you think about it, the top 3 areas that people get Botox: the forehead, the frown, and the area around the eyes or the crow's feet. Those are the areas of the face that have the least amount of fat. Take your forehead. Everyone wants that ultra smooth forehead. What's up there? You have skin, but a muscle called the frontalis creates most of the volume there. So when you shrink a muscle, you get atrophy. It's why we use Botox in the masseters to slim the face. And it can be wonderful if you have an uneven jaw, if you're grinding your teeth and you're losing your teeth. Same thing, you can treat the temple with Botox if you're grinding, or if you're even getting headaches or migraines, it can help. But in an area where your muscles creating a lot of the volume, when you shrink that down, you get the aged look. You're losing facial volume. And if you know anything about following my channel here, facial volume, your fat pads in your bone, are what keep people young looking. Now, this is nothing new. Also, if you're following me on this channel, you see this video I did before. Botox may be aging you. So again, if you subscribe here, you've known this for 3, 4, 5 years. My old videos, they're still up there. You can go back and watch those. If you don't know the difference between microtox and baby Botox, there's an important distinction. I'll put a video at the end as well, because you need to know those differences. One is a problem and one isn't. Now look at this article. We need to dive into this because I want to show you this mechanism of action, because things even get a little bit worse. Baby Botox may worsen wrinkles, but how? The authors concluded that aesthetic botulinum toxin injections may result in atrophy of the injected facial muscles. Great, we've known that for a long time. Agree there. But look here. In fact, permanent changes in muscle composition such as increased collagen and reduced strength, may occur even after the muscle regains movement. But here's where it gets a little bit worse. In one study involving 2 men, a significant reduction in muscle volume lasted up to 1 year after the injection. Now I know from being in clinic, if you get a drooping brow, let's say, from treating the forehead, most people that will come back in 4 to 6, 8 weeks, the longest. But there's a group of people where at 6 months, they still have a slightly decreased brow on one side. So it isn't just about bringing back what we call the acetylcholine at the synapse. There's other factors at play and sprouting along the nerve fiber. The point here is there's long-term consequences of shrinking of that muscle beyond the 3 months, which begs the question, and we'll go back to marketing and big pharma, why is everyone being told to get this done every 3 months? I'll submit that it has to do with people not paying attention to the real problems like hormone loss, collagen banking, the lack of collagen banking, sugar glycation, and not paying attention to the elastin and collagen support of the skin, which brings me to 3 things that you should do. Number 1, limit your Botox injections. For most people, if you're taking care of your skin, you have a good home skincare routine, you're not going to need Botox injections more than twice a year. Maybe a third time you have special events, but remember, collagen is king. Collagen makes up the majority of the structure of your skin, and of course, elastin makes up 10%, but that's your bounce. Pay attention to those 2 things. Number 2, collagen bank with all natural things. Think red light, LED light, gua sha, facial exercises. I presented a study on facial exercises a few videos back that you can go back and look at with collagen banking. And also think about lightweight face oils to massage with at the same time as your gua sha or facial exercises and massage. Think things like, I know a lot of you use castor oil for your lashes and your brows. That's a great time to think about facial massage, or more lightweight oils like safflower oil, sunflower oil. Many of you like argan oil or even emu oil. Those can make a big difference, especially in those areas where the 3 most common areas where people get Botox done. Now, number 3, this is really important because when I was making up the protocols for PRF, Easy PRF, and Easy Gel, we knew then that there was not any cases of legitimate blindness or arterial occlusion, those side effects you can get with regular fillers, but that it helped rejuvenate, volumize, and make your fat pads better, which is exactly what you want in your complete face. But for those of you that don't want it injected because of the theoretical risks, what about microneedling it in? So what you do is you draw the blood, it's a slow spin, and that makes sure that you get your exosomes, your growth factors, and your mesenchymal stem cells. Those are the 3 things. And remember, this isn't someone else's fat. It's not someone else's exosomes. It's 100% natural. It's all you. There's nothing even added in the tube that we spin. So there's no blood thinners like heparin or sodium citrate that's in PRP. I don't like PRP. In 2014-15, making these protocols, PRP did not stack up to the results that we see with PRF. So look for PRF. And I saw that at the time, especially in the forehead, around the eyes, and the glabella. I trademarked plasmaglow.com, and you can go there and you can see before and afters. You can see how it's done. You can watch the procedure, but this takes about 30 minutes. It's only a 5-minute spin of your blood, and then the microneedling. You can use topical anesthetic, but many people don't need it because the vibration of the pen works by what we call the gate theory of pain. The vibration makes the nerve stimulate right away so that the pain fiber can't track down that nerve, because it takes a few milliseconds for that nerve to recover. And by that time, the needle is out of the skin. So the gate theory of pain, you can look that up if you want. So, but some people want to use topical, you can. And you can combine plasma glow or PRF microneedling with other procedures, of course, like injecting this product. Many people combine it with lasers or fractionated radio frequency at the same time, or even RF microneedling to reduce fat in some areas like the submentum and the downturned mouth. But understand, PRF is what you're trying to look for to help rejuvenate, especially those areas that you're Botoxing now that maybe you're going to slow down on your Botox and maybe even avoid it altogether. Chemical peels are another good addition to that. So now there's two videos you're going to want to watch. One is on collagen banking up here, and one down here on glycation, because I think if you can avoid glycation, you easily look 5 to 10 years younger. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.